Healthcare-associated infections, also known as HAIs, are one of the leading killers in the U.S. today, behind heart disease and cancer. Affecting up to 2 million patients a year, the heavy burden results in severe infections and deaths of up to 99,000 people, with the additional annual healthcare costs between $28 and $45 billion. Federal and state governments, along with private payers, are now restricting payments for healthcare-associated infection costs to hospitals. This is resulting in a major industry shift in the implementation of infection prevention and control programs. HAIs are problematic due to an overwhelming abundance of dangerous organisms, which are being combated with an insufficient amount of applicable technologies and low compliance of existing infection prevention and control programs. The main focus of these programs is to disrupt and reduce the contamination of organisms through the 3 environmental routes: air, surface, and water. According to the CDC, hospital floors become contaminated with microorganisms from settling airborne bacteria by contact with shoes, wheels, and other objects. Even with chemical disinfectant applied to floors in a hospital, the same surface, after testing, has been shown to have bacterial counts back to the pretreatment levels in just a short period of time. The introduction of HealthySole Plus is the first and only 24/7 active line of defense that kills up to 99.9% of the infection-causing organisms on the bottom of shoes. Once killed, these organisms cannot transfer, migrate, or spread throughout the environment, which significantly decreases the overall microbial burden and reduces HAIs. HealthySole Plus is the missing step in an infection control program's line of defense. Once implemented, HealthySole is immediately effective and does what no other product can do. On any given day, 5 to 10% of patients in a hospital contract an HAI. The 5 most common organisms that cause infections are C. difficile, or deadly diarrhea, Staphylococcus aureus, that includes the drug-resistant type known as MRSA, Enterobacteriacea, or CRE, the nightmare bacteria, Enterococcus, and Pseudomonas. Starting January 2015, CMS began using C. diff and MRSA infection rates as performance standards to determine the reduction of inpatient Medicare reimbursement. By 2017, 5% of Medicare reimbursement will depend on infection rates and patient satisfaction surveys. In the past several years, improving infection prevention and control programs has been a focus of the industry as a whole. Investing in new technology and programs to prevent infections that lead to thousands of deaths significantly outweighs the burden of cost and death related to these infections. Finding effective new technologies to reduce contamination is at the top of the list of hospital C-suite executives. In hospitals and other healthcare facilities, millions of organisms enter and migrate throughout the facility on the soles of shoes. It is clinically proven that with each step, there is a 90 to 99% transfer rate of organisms from the shoe sole to the floor. Due to the movement of people, equipment, air currents, and HVAC systems, the microorganisms become airborne, then are inhaled or settled on other surfaces, resulting in HAIs. The HealthySole Plus system by Detecto offers the first chemical-free, no-touch, active disinfection technology that uses UVC light to significantly manage the spread of infectious organisms traveling on the bottom of shoes. Our exclusive active disinfection technology allows occupants of any environment to consistently lower the microbial burden throughout the day with no additional workload. No-touch technology systems are a valuable method of decontamination because it does not incur additional labor cost and is less likely to cause cross-contamination than alternative disinfectants. HealthySole Plus is an active line of defense that kills and eliminates millions of microbes on the soles of shoes or booties before, during, and after a person enters any environment within a healthcare facility. HealthySole Plus effectively works in just 5 to 8 seconds, and when constantly used throughout the day, it eliminates up to 99.9% of the exposed organisms on the soles of shoes. Exposure tests have proven that depending on the shoe type, HealthySole Plus has up to a 97% UVC germicidal light exposure rate to the soles of shoes. This effectively lowers the overall microbial load on the floors, in the air, and on elevated surfaces and equipment. These organisms, without the interruption of HealthySole Plus, would otherwise present inhalation hazards or settle on wounds, catheters, and other equipment. The HealthySole Plus can also track infection control protocol compliance of the faculty staff to ensure that the most effective outcomes are achieved. Over $15,000 is the average cost to a hospital per patient contracting an HAI. Extended treatment costs to a hospital on a per-case basis can exceed $45,000. This average does not include CMS and Medicare loss of reimbursement that follows the medical facility in the following years. 10 HealthySole Plus units equals $39,990, which is significantly less than the average cost to treat 3 patients that contract an HAI. With the HealthySole Plus, healthcare facilities can take a new, effective, and groundbreaking step toward decreasing HAIs, reducing treatment costs, length of stay, and saving lives. One common goal: disinfect and protect.